multiple platforms. Hey, Ceci.
How's it going, guys? We have really good news today. I'm going to let him do the talk and the discounts for me, huh?
Yeah.
Are we going to be
No
serious about
discount
the
for you.
discounts today?
So we're gonna be answering questions. We are here in Top Aesthetics Official. We are on Magic Surgeon. We are on our Facebook as well and YouTube. So we are live in multiple platforms. If you guys have questions, shoot some questions and we'll be answering questions for you. If you have questions about your upcoming procedure or you want to show us your amazing result, then we are looking forward to see it as well. We're looking forward to chatting with you too. So if you want to jump in and interact with us, then great, we'll do that. So we're gonna be also showing some cool stuff that we are preparing for you, and I want you to check things in that we are doing here on our website. We're gonna show you some tricks about financing that are pretty cool. So let's see if we can chat with somebody here. Let's see, Margarita wants to join us. So, how's everybody's weekend? Hopefully it was good. I know if you were traveling this weekend, it was kind of hard to travel. So, oh yeah, well, nice talking to you. So if you have some questions, then let us know, okay? I see, it's just these kids. Okay, there you go. So if you were traveling, this weekend, it's hard. I know there was a lot of snow some places, but if you live in Florida, then it's no problem. Let's see. So La Vera, La Platinum. Let's see some of the questions here. 2 weeks after surgery, I'm feeling great. Well, Mia V, if you want to show us your results, let us know. Hello, Esnam. March, Yvette's coming in March. Let's do that. If you guys have some questions en español, si tienen preguntas en español, también nos pueden hacer las preguntas y con gusto se las responderemos. For those of you that speak Spanish, here we are. We have a lot of people from Cali here. We have a lot of people, you know, they come in from many places around the states. You know, 90% of our patients are not from the states. So if you are from other states, we have amazing packages for you to stay. You don't have to worry about anything. Estamos ubicados en Fort Lauderdale, muy cerca de Miami. Así que estamos aquí muy cerca del aeropuerto de Fort Lauderdale, que queda más cerca o es más accesible que el aeropuerto de Miami. No me gusta el aeropuerto de Miami. Es muy ocupado. Okay. So I'm gonna show you something that everybody answers or asks about how to get financing. So there's something really cool in our website. So I don't know if you are all familiar with our website. See if you can guys see it here. Everybody can see it. So in our website, if you go to the area of, let's go to home. So if we go to here, resources, in this menu right here, it's kind of hard to see. There's resources right there, the menu. See, I'm gonna try to take it so you can see it. And then you go in the resources section, you go to the last one, it says finance, then it opens the finance section. And in the finance sections, for example, you can click the Care Credit area and it will take you to the Care Credit website. In the Care Credit website, this is our section of the Care Credit website. So you go to the corner right here where it says calculate, up in this, you know, upper right corner, and then you click the calculate and it opens a calculator for financing. So you just have to put the price. Let's say if your surgery is gonna cost, let's say $8,000, or let's make it 10,000 to make it easy. So that's $10,000. Then you put calculate, and then for our practice, it's gonna give you the financing options. You know, with all the different results that you can get for financing. if you finance it at 6 months, if you finance it at a year. So it gives you all the options. If you finance it, let's say at 60 months, then it's gonna be $254 per month for 60 months. Anyway,
Can we show the online
check it out.
consultation to send you the form in the computer? They're asking.
Also, to send us a consultation, easy. So the same thing, if you go to our website, you go to free consultation on the top, and then you just fill out that form. It's a form. You fill out a form, see if we can. It's a pretty straightforward form with like 10 questions, and you have to submit some pictures, and that's it. That's all you have to do. And then we will get you back within 24 hours with a quote for you. And after we review with the surgeons, review your, let's say your case. Okay, let's see if we have. Raquel might want to join here.
Angelique.
Is she there?
I think I just saw her.
Okay, let's see. Hello.
Hi. How are you?
Good. How are you?
I'm good, thanks. So I have a couple of questions.
Tell me.
I was supposed to have surgery with you on the 24th of March,
Okay.
but my coordinator called me and moved me to next week, to the 14th of this
Okay.
month.
Of March or 14th of February?
Yes. So I am freaking out, and I've been reading a lot of messages, and some of the messages that I came across mentioned something about like your the blood pressure. Like if you're really nervous and anxious, like I don't have any issues with like blood pressure or anything at all. Like I don't take medication for anything. But I did tell my coordinator that I was going to be nervous. I guess it's normal. And I'm like, what if my blood pressure is too high? So I was reading comments saying that some people have had to like reschedule because of that. Have everything down, so rescheduling would not be an option for me.
Right. No, that's a good question. I was talking to a patient yesterday about that same question, and that's why I think it's a really good question to talk about. Usually if you don't have any history of high blood pressure, you don't take any medications, then it's normal to have people that is nervous, and they might have a higher blood pressure. The blood pressure, we are usually able to control it pretty well when you have not had previous treatments or you're not in any medication for blood pressure.
Yeah.
The problem comes when you are being treated for blood pressure and your blood pressure is not under control. It's called uncontrolled hypertension, or in those cases, especially if you are taking some medications for it and it's not well controlled, then that is the problem. So if you're nervous and your blood pressure is a little high, this is easy for us during the surgery to control it. So it's not a big deal. If you are not in a scheduled medication, then definitely it's not an issue. No, you can take your blood pressure, at home, and if your blood pressure is fine and you don't take any medications, it's most likely you won't have a problem with us.
Yeah. Okay. Yeah. That was one of my concerns. Like I said, I don't take any medication for anything. And so the other thing was, I had COVID on the 1st of January.
Okay.
And I had a fever for like a day, and then I was fine, and then I was experiencing shortness of breath, and I had a cough for like 2-3 weeks after all my other symptoms subside. And I again, I am a very healthy person, or I try to be. I know my body very well, so when something doesn't feel right, I go to my doctors, and I get regular checkups. So because of the coughing and everything, we did like 2 x-rays to make sure that nothing else was going on. The x-rays were good, and they didn't ask me for these during my pre-op, but I sent them because I just like to be very thorough with everything, and I want everything to be okay. I even sent like test from my of thyroid, which you guys again didn't request any, and I don't have any issues with it, but I wanted to make sure I was okay.
Great.
So anyway, the X-ray came out okay. But I spoke to my coordinator, and she says that she didn't mention this to the pre-op team that I had COVID, and because of COVID, I know that I'm at a higher risk of blood clots. So I'm really worried about that.
Yeah, no, that's a good question too. I don't think, obviously the COVID, during the period that you're sick with COVID, it will make you a little bit more prone to having blood clots. Now, surgery on itself, it's a procedure, it's kind of an event that will make you more prone to having surgery because of becoming blood clots because of the immobilization. So that's why we are prepared to take care of any issues with that regards, and that's one of the things that we are most prepared for. We use the compression stockings, we use obviously the sequential compression devices for massages of your cuffs during the surgery. We also have frequent and ambulations in as soon as you start getting up after surgery, and we start with anticoagulants too, depending on the procedure you're having done. But you're actually gonna be on anticoagulation right after surgery with us, especially if you're having like a tummy tuck or lipo. In those procedures, we always give yourself like a week of anticoagulation. So, and if we have any sorts of concerns or anything, then we will do an ultrasound, just to rule out a DVT or something like that. So we are constantly monitoring that.
Yeah, because I was like, I'm not only like, scared about like the whole, just having surgery.
I think I lost you for a little bit. Well, let's see if I don't.
Okay, well.
All right, sorry, but I can't see. I lost you and it's not coming back. Doesn't seem to be coming back. Yeah, but again, we are very well prepared to deal with blood clots and very well prepared to prevent them. Here we do everything that it needs to be done in order to prevent that. So let's see if we can answer some more questions here. How long after a miscarriage can I get a mommy makeover? So usually 6 months will be the very best option for you. 6 months will be appropriate. Let's see if we can bring Angelique. See. The other side got. Hello.
Hi.
Hey. Hi, Angelique. How are you?
Hi, I'm good.
Where's
Good
my
to see
hero?
you.
Where's my hero? I was the one talking to you, sister.
How are you?
Yes.
Listen, I am stunned by your results. You look amazing.
How's Canada?
It's 5 weeks tomorrow.
5 weeks?
Wow.
Yes, I was there January 5.
That's amazing.
My surgery was January 5.
That's right.
I'm all the way from Canada. I will go there in Florida just to see you.
I know.
Hi.
How cold is there now?
Oh, it's 5 today. We are warm actually.
Wow.
Wow.
Yes.
Well, if you guys want to see Angelique's results, you have to jump in
Yes.
here.
You have to jump and show us. How do you look?
Because I don't shop the bra right now because I don't know my size yet.
Okay, no problem. No problem.
That's awesome.
Oh my goodness. Look
look
at this.
amazing.
You look amazing.
Yeah. Wait.
I cannot believe it. Look at your waist. It looks smaller in the camera than in the pictures.
Yeah, it looks amazing.
Wow. It is amazing. I want that.
My BBL. And my belly button.
Wow, 5 weeks, huh? If you like
5
it now, it's gonna be
weeks.
amazing in a few more months.
Do another spin so people can see you. Amazing.
So you have the breast, you have the tummy, and the booty, everything.
Yes.
That is
Do
pretty
you think
amazing.
I still need more BBL?
I don't know. Do you think?
Listen, honey, I need a BBL, not you, okay? Are you kidding me?
No,
I
absolutely.
don't know. Do you think I need more?
Okay, turn around. Let's see. I'll evaluate you. Let's see. Turn around.
We have
Turn
here
around.
Cecilia's quality control.
Okay, listen. Listen.
Yeah. No,
Scoot.
Ceci.
You tell me now, okay?
There's no competition.
I don't know.
No, you look amazing.
You look amazing. I mean, I would always get more just because a little booty that it sticks out. I really like it, but it looks really
I
good.
love it. My waist now is so small.
That's amazing.
It is really, really
Yes.
small.
So-
Dr. Paladino is the best.
It's the best.
Yeah.
It's the best.
It's the best.
You won't find another one. He's amazing.
All the way, go there.
all the way from Canada, you can.
Look at this body. You're like a model. Are you kidding me?
Yeah.
Look how beautiful. Listen, what size of suit? I love that you do the little dance. Put some music and dance for us.
So, do you remember what size
The
implants
of
that we use?
Yeah.
This is the 3D.
I don't remember. It was
Don't remember.
the triple
You
Ds.
told me you give me
Yeah,
550 cc.
550.
Oh,
Yeah,
okay.
that's
Yeah,
correct.
that's, I
What
figured.
size is that?
That's also. Yeah, it would in somebody like you. It's probably like a triple D. You're right.
Yeah.
Yeah.
It looks, I can't believe your waist. Like how small that is.
It's so small.
It is
Yeah, it looks
tiny.
great.
I'm getting ready now for summer.
Bring it here so
Wow.
they
Let's
can
so
see
other
you.
people can see. So spin around again. I want a BBL like this, Dr. Spin. Look, your BBL looks
Yeah, it looks
beautiful.
amazing.
I
Yeah.
cannot shake my butt yet.
I know, right?
Listen, you don't have any cellulite either.
No, she has a great body, right?
No cellulite, no how do you call it? No,
Great skin.
arterias. ¿Cómo se dice
Yeah,
arterias?
no stretch marks.
Stretch
I
marks.
massage every night for a month.
That's awesome.
I can't believe you're 5 weeks post-op.
My mom
Post-op.
massage me every night
That is.
That is
Are you
amazing.
wearing your faja?
because it's helped the massage every night
Good.
because the lipo at the back it's a little bit like numb and hurt a little bit, but my mom massage every night. It's helped a lot.
That's awesome.
Like,
Yes.
That's why I got recovery right away, and then after 3 weeks, I go back to work.
Very good.
Hey, for those like they worry about tummy tuck, it's not hurt at all. For me, I'm honestly speaking, it's not hurt. That I'm just worried about it
Right.
before that it's gonna be pain, but for me it's not.
That's
So that's why I'm so glad that I go with Dr. Paladino.
No,
That's
you
all
look
right.
so, Angelica, you look like a doll. You know, like those little cute, small, petite dolls like that.
If I'm gonna do it again,
You're gonna do it. Listen, do the little dance again. We want to see you again. Look at this. Look at this.
Nah, you look amazing.
I love it. You're gonna have to get a bigger bra now. It's too small for you. You're so cute.
Yes, I need a bigger bra.
No,
Listen, I can give you my bras, okay? Well, no, they're too small actually.
Yes, I really like my waistline.
No, the waistline is amazing. Now, can you show us? I want to see
I
your scar.
don't know if I'm still swollen. I'm still 5 weeks right now. What do you think,
Yeah,
Doc?
absolutely. No, it's swelling.
But my waistline gets smaller.
It will get smaller. Yeah,
But I
keep
really love my
keep doing the massages.
waistline.
Keep doing the massages and keep wearing your compression. You know, with the compression, the massages.
I'm wearing daytime the waist trainer
Perfect.
and paha at night.
That's awesome.
You
That's
look
awesome.
amazing, Angela. Amazing. I mean, every day I see your pictures.
Waistline.
Keep sending your pictures and your video. I'm promoting you everywhere because you look stunning.
Yeah.
She's drinking
It
her
looks-
little things. You're so cute.
Mm.
Oh, there's somebody there.
I
Hi.
want to get it done too.
Hey.
Now we're gonna get a lot of customers from Canada with you.
Now listen, Angelica, do me a favor. Do you have you only have one cell phone, which is this one, because people are asking if we can show a picture of you before the surgery. But you have only one
Right,
phone,
right.
so she's using it from her phone.
Right.
No, it's on my phone. I'm using my phone
Right. I
No,
figured.
no, it's-
Because I wanted to see. People are asking how you looked before. You know.
Yeah.
Yeah.
Did you still have a small waist before?
I have my extra skin on here. I don't know. Maybe Dr. Paladino remember me?
Of course, I remember you very well. Yeah.
Look how
it's
turn
just-
around, spin for us.
We should
It's
post.
not small like this. Not really.
Yeah. No. I
Now
know.
it's so small. I really like
Really
it.
small,
Yeah.
really
Like,
small.
No, it's an amazing change. You'll see.
um,
We'll soon be putting together some before and afters.
Wow,
Just need to
look at that
cover them.
BBL. Look at that BBL and look at this BBL, huh? I got a long way to go, Angelica.
You need to put on some weight first, Ceci.
I have some extra weight, doctor. I
Nah.
promise you.
Nah.
Listen, I need to get a BBL and probably now a breast augmentation that I'm seeing you, okay? They look really
amazing.
They
good.
look natural.
They look natural. They really do. Does it hurt? Does the scar line hurt?
No, it's not
No.
hurt.
How was your pain? That wasn't bad during the surgery? I mean,
No.
the recovery?
Because I already did before the breast reduction
Right.
here in Canada.
Right.
So I don't know. I don't feel hurt. Only annoying me is the BBL, to sit down in the washroom, to sit on the chair like that.
Right.
It's
Listen, honey, for that BBL, I'll do anything. You look amazing. Who cares? Just put up with the pain and that's it.
I'm really glad that I did it, the BBL.
It looks really good.
Maybe I.
No, that's important, because a lot of patients ask, should I do the BBL?
Let me do the dance of the not BBL. This is the
Yeah.
dance of the no BBL.
Do more BBL or no?
Exactly. Well,
Or this is already good on me today.
you
I
just
like
have to
this.
wait. I think it's pretty good, actually. But, you want to just wait for now,
Wait for now.
Yes,
Okay.
yes. Actually,
Because I'm Asian, right? Maybe when it's too big, it's not look nice on me.
You
you're
want the
right.
natural
You're
look.
right. But I think your size right now, you're very proportionate. So everything looks really good. I would just,
I tell to everyone, those who really interested for BBL, it's super nice.
It looks
Yeah,
really good.
yeah.
Angelica, no, you look amazing. Do a little dance. Do a little dance. Do a little
See?
dance. Let's do the dance of the non-BBL and the BBL.
I cover my nipple.
Yeah, I can see that. But wow, sister, you look amazing. No, I think
So-
that BBL looks natural, actually. I really like it.
How was your experience here at the hotel and the massages and
My
all that?
experience
Yeah. Was it
on
all?
the surgery,
Yes.
I'm really happy for my surgery because the package is included, the hotel, and then the nurses is very good that they keep checking me for 3 days, and then
The massages?
if I have any question about, until now I'm here in Canada, like question about like any question about how I feel, they reply right away.
Right.
Yeah, my recovery is very good. I don't have problem any at all. So I don't know. I don't have any problem. Just only the annoying is my BBL when I'm sitting down everywhere. Yeah.
I remember, and then they're asking for your breast, you have 550 cc's of
Yeah.
implants that you are probably more like a triple D probably at the moment. So
Yeah.
And that's
my
probably
height
what-
is 5'1".
yeah, exactly. That's
Yeah.
exactly right. So yeah, it's you look amazing. It looks nice in you. It looks proportionate, and then now
I'm
you're
5'1".
yeah, that's amazing.
Listen, you're going to be my inspiration.
How tall I am.
From now on, you're going to be my inspiration, Angelica, okay? I'm going to think about you every day. Look at this. Look at this. Goodbye, BBL here.
Yes, this is 550 cc.
Oh my
Amazing.
goodness. Wow. You look amazing. Amazing.
But I really like it. I like this size because it makes my waist more smaller.
Even smaller.
Right,
Of
right.
course. And it makes you like good roundish hips.
I'm really glad Dr. Palladino picked this size for me. He told me this is suit for me. It look more nicer. So I'm glad that I don't get the 400 something.
Good.
550 is very nice on
Paige,
my body.
look at that.
Look at that. Look
This
at that.
is in the Top Aesthetics. Now here you can see, because she's a magic
Yeah.
surgeon, so if you want to see it, check out the Magic Surgeon Instagram, and then you can see Angelica's amazing result.
I'm
Yeah.
posting her videos everywhere though. Because
They're asking to see, can you lower your panties just to see the scar on the tummy?
Oh, okay.
Yeah, just a little bit, because it's five weeks only, so you can see, yeah, the scar looks a little bit, yeah, there you go.
a little bit reddish,
That's
but
awesome.
that's only
Yeah, it's a
5
little bit
weeks.
darker
It's
just because 5
perfect.
weeks, but it looks amazing.
Yeah.
Yeah, it's super nice. And
Looks
straight.
really nice. Angelica, your clients are really happy with your butt. They say that you look really good, huh?
Yes. Not only that, make my pussy nice shape.
See? Yeah, it lifts everything that's fallen. So
Wow.
More sexy looking.
we love the.
I really
honest
happy
patients.
Dr. Palladino.
Palladino's the best.
My
He's the best.
face. Look more nicer, everything. Look like full package. Yeah, like I'm a new body.
Yeah, that's awesome. You have a beautiful body now.
You have a beautiful body.
Yes.
That's
Yeah.
She
amazing.
did tummy tuck too, actually.
Okay.
In here, and then she maybe she gonna come to you this year. She want to get her breast done.
Very good. Well, you know where to
Doctor,
find
yeah.
us.
She have a problem. Her tummy tuck, not all the fat was come off. Then she still have a. She asking me like what she need, and I told her send you the picture because she really want to be like small waist like
Right,
me.
right.
I'm skinny.
That's
Yeah,
perfect.
but I don't know. She's shy to show her body.
Well,
Skinny.
she's skinny. Yeah, what you can do, you can always send us the pictures, you know. Send us a free consultation. It's free. Go
Yeah,
to the
I will tell
website.
her to send the consultation
Yeah.
to see the picture.
And we're happy to
Yeah.
tell you what
Listen,
we think about
honey,
it.
worse than this, I'm sure it's not going to be, okay? So you just go ahead, send whatever you have to send, and we'll take care of you.
Oh, I don't hear it.
Yeah, just
Pardon again?
you
her friend.
you just tell her to send us her free consultation, and then we will tell her,
Yeah,
you know, what she
I
needs.
will
So,
tell her.
yeah,
She
very
really
good.
like to get done too. Either her boobs or her BBL.
Okay, perfect. Do the super combo like you did.
I'm gonna take a picture. I'm gonna that body that you have. I'm gonna put in my wish pics. You look amazing, Angelica. I want
Yeah.
that BBL.
She's gonna be the wish pics.
I want your BBL.
Yes, I'm so happy the result.
It is
That's-
amazing.
Totally brand new body.
A brand new body.
That's amazing.
I can walk outside now naked.
In Canada,
In Canada.
How nice my body is.
where is it? Edmonton is
I'm so
like
proud with my body right now. I
Ma-
can go naked.
in minus 30.
Minus 30.
Yeah.
That's amazing. Well, thank you so much. Thank you. I'm
Yeah, thank
very
you,
glad
Angela.
you're
I'm
doing
so
amazing.
glad, yeah. I convinced to all girls if you are interested, please go with Dr. Palladino. He's a really a magic surgeon.
Thank you very much.
Yes, thank you so much.
Thank you, Angelica. Be good. Keep in touch, okay?
Yes, no problem.
Thank
Bye,
you.
guys.
Adios. Yes.
Bye.
Adios. So yeah, so you can see 5 weeks and she's doing amazing. Hi Nancy, Fancy Nancy's here too. She also has an amazing result. He's a massive weight loss patient, so she had a lot of surgery as well, and she looks amazing. Let's see. How much experience do I have with thigh lift? Too much, unfortunately. And I don't wanna. I wish I didn't have as much experience, so I don't have to do that procedure too often. But unfortunately, I have a lot of experience, and you know, thigh lift are not one of my favorite procedures. I tell you that much. Thank you, Nancy. Thank you very much. Thank you so much for your beautiful words. It's nice to be able to improve the quality of life for all the patients. Let's see how ¿se puedo pedir financiamiento con una cuenta de UK? No creo que se pueda pedir financiamiento con una cuenta de fuera del país, o a no ser que busques financiamiento en tu país. What's your favorite procedure? Well, my favorite procedure is tummy tucks. That's you know what we do, but we specialize in combos. So tummy tucks with BBLs, tummy tucks with breast, or breast tummy tucks and BBLs, and that. So for si tenemos especiales muy prontito, quédense por ahí y esténse atentos porque por ahí viene algo, así que no puedo decir mucho, pero pronto, muy pronto. Let's see, so what is about someone that is taking medication for blood pressure? For those of you that are taking medication for blood pressure, as long as your blood pressure is under control, should be no problems. So it's good that you're taking the medication to make sure it's under control. But just make sure you check your blood pressure and make sure it's good. We're gonna go over, let's see, let's go over some BMI. So, you know, we have in our website If you go to topaesthetics.com/BMI, there's a BMI calculator and also all the recommendations that we will give you. First of all, tell you that because I can't tell you only so much here. But if you go there, there's a lot of more information. You know, when you go to the BMI section in our website, that you can calculate that. And pretty much, if you're thinking of having a tummy tuck, thinking about it's best to have a BMI below 30. You know, so after 30 is obesity. So from 18 to 24, it's normal. 25 to 30 is overweight. 30 to 40 is obesity. Over 40, you can't have surgery with us. So, but for certain procedures like a tummy tuck, let's see here. Here we have your super tiny phone. So if you go here to the BMI section,
which is in resources.
Yeah, in resources. Then in resources, you can get to the BMI. It's easier in the computer. Here in the phone is.
The phone is
I mean, you can find it, but you know, it doesn't.
It's too
It
small.
doesn't
You
get.
can't
So
see it.
here's the BMI. There's a BMI calculator there. You can put your height, and then there's a lot of recommendations. You know, that's here. See.
It's like a calculator, which is
It's a
perfect.
calculator, and then it tells you all the recommended BMIs that we have. So go check it out, and that's all the information that you need to know is there. For tummy tucks, less than 30 is best. For lipo, BBLs, you can have, depending on your age and so forth, you can be up to 39. Let's see. I'm so excited. Okay, well, it's great. Patient is excited that went with us.
Very important question. Okay, so let me go over this, which is very important. You guys, it's important that you know this. Wow, 4 cameras. I feel like a celebrity right now.
All right.
So here's a very important question. If we pay the deposit now for $500, which is, refundable towards your surgery, do we have to get the surgery right away, or we have time to get it? You have a full year, 12 months to get your surgery once you paid the deposit. So let's say that you don't have the money right away, but you'll have it in 6 months. Well, then you book the surgery now if you want, because actually inflation, you guys, is hitting everybody. The prices are gonna go up eventually. So you want to lock the good prices now because we have really good prices. You lock the prices now with the combination that you want, the procedures, if you only want one. $500 the deposit goes towards surgery, and you have a full year to book it.
Yeah. And I just show at the beginning of the live transmission how to get to us for the booking. But let me show you again. If you go to Top Aesthetics, here in our website, then you go to the section that says resources, and then in resources you go to finance, and in the finance section you can go straight to where it says care credit here, and then you can calculate in care credit. Go to the corner, it says calculate, and then you can calculate how much are the payments, if you finance, let's say $10,000. So if you finance $10,000, it gives you all the options for all the payments. If you do it like depending if you do that 6 months, 1 year, 2 years, 6 years, whatever it is. So you can have all the definitions there and the breakdown. So that's pretty good. Okay, let's see some more. The surgery has to be within the year that you submitted your deposit. So that's another question there. Yes, it has to be within that year. Go back to the questions here. I was told to stop medication 45 days before surgery. Is a specific reason for this? I'm nervous to take it for so long. So there are, we go through a pretty, very complete preoperative process. So we evaluate different medications that the patients take, and we'll let you know for each one of you whatever needs to be stopped and how soon. Hola Julio desde Argentina. Rocky. BMI of 31 is probably okay if you're having some lipo. It's really depending on what you're having done and the fat distribution. But Rocky, send us some DMs later. I'm happy to take a look at your particular case and get just back to you with all the information. So definitely do that, and I think, let's see, we can get Bridget here. Let's see, we can bring Bridget. We can give you the recommendations just for you if you have questions. Don't stress out. Let's just take a look at your case. Bridget, are you there? Let's see, she wants to come in. I can see the hello.
Hi,
How are you?
I'm very good, thank you.
Good talking to you. Has any questions?
Yo prefiero hablar en español,
Bueno, hablemos en español.
pero no sé si la audiencia entiende mejor en inglés.
I can translate for them.
Ah, perfecto.
Cuéntame.
Sí, bueno, a mí me encantaría operarme con usted, pero estoy en Escocia.
Ah, bueno.
Entonces, no sé qué tan complicado sea.
Te puedo decir, Escocia está casi tan lejos como California.
Bueno, eso sí.
So, no.
Pero,
Ajá.
¿cómo son las cuestiones de financiamiento en el
Ujú.
extranjero? O sea, sí. ¿Cómo se hace? Pues?
Sí, normalmente las veces que la gente ha financiado desde el extranjero lo han hecho con un banco en su país. O sea, un banco en su
Ok.
país financia, porque sí, de verdad, con una cuenta extranjera han tenido problemas para financiar aquí. Tienes que tener residencia aquí para poder financiar a través
Claro.
de los Estados Unidos. Pero puedes intentar hacerlo a través de alguien en UK o en Escocia. Definitivamente
Ok.
eso. Sí, eso definitivamente puede funcionar. Y lo han hecho antes.
Ok. Y otra cosa que quería preguntar, lo que pasa es que está un poco distraído y no sé exactamente de qué se trata el live que tiene. Si es
Sí.
cualquier pregunta o son preguntas en específico.
Normalmente preguntas generales son mejores. Si son específicas, con mucho gusto hablamos aparte y las tratamos. Pero sí, cualquier pregunta, dime.
Claro, no, lo que pasa es que el tratamiento este de J-Plasma,
Sí,
tratamiento nuevo.
exacto. Sí, es relativamente nuevo.
Sí, yo tengo mucha curiosidad de qué pasa con la piel después del tiempo. O sea, ¿la piel vuelve a su flacidez que tenía antes? ¿O
No.
se queda? O sea, yo sé que, claro, la piel sigue envejeciendo, porque no sé.
Correcto. Pero siempre es como que reseteas tu reloj biológico, como que vuelves antes, ¿no? O sea, que la piel se va a contraer, la piel se va a hacer más resistente, más plana, y vas a envejecer desde ese punto. O sea, que no es que vas a acelerar el envejecimiento de eso, vas a envejecer. Lo mismo cuando te haces un facelift, ¿no? O sea, no es que te vas a ver 10 años más joven para el resto de tu vida, ¿ok? Porque como que reseteas. Lo mismo le pasa, el tema de la piel es igual. O sea, que reseteas el clock de la piel para atrás, entonces envejeces desde ese punto, básicamente. No vas a tener siempre menos flacidez, vas a tener siempre menos irregularidades y demás. ¿Ok? O sea,
Ok,
que
o
sí
sea,
ayuda.
la flacidez que te quitaron vuelve otra vez, ¿no? Es
Va a volver,
flacidez
pero
que comienza
mucho tiempo
después.
después. Mucho tiempo después, ¿me entiendes? O sea, si ibas a tener esa flacidez a los 60 años, bueno, la vas a tener a los 70 años probablemente. Es como que paras el reloj, pero lo vuelves para atrás un tiempo.
Ok.
Así es
Ok.
como funciona básicamente el envejecimiento luego de hacerte procedimientos.
Claro, eso era lo que quería saber. Y también me gustaría tener una cita virtual con usted. No sé dónde llamar.
Normalmente,
No sé,
mira, normalmente lo que requerimos es que primero que mandes tu consulta gratuita a través del website. Una vez que evaluamos tu caso, hacemos tu quote y todo eso, tienes dos opciones. O puedes pagar la consulta o puedes hacer el booking. Cuando haces el booking es como pagar la consulta. Entonces podemos chatear cuando quieras. O sea, yo me siento, miro tu caso detenidamente y hablamos por teléfono, por Zoom o por, ¿sabes? Un videoconferencia si quieres. Y hacemos eso. O sea que los pasos son eso. Pero lo más importante es que nos mandes primero tu consulta para que poder evaluar tu caso y hacemos una cosa. Es gratuito eso. Yo me siento, veo tus fotos, hago un plan para ti y te mandamos un estimado. Y con ese estimado luego podemos coordinar después de eso una consulta.
Ah, buenísimo. Sí,
Ok.
porque yo el otro día yo estaba rellenando todo, pero luego vi así como que, ajá, tenemos el derecho como que decía, como de mandar electrónicamente todos tus datos y estos, y yo dije, ya va, o sea, yo quiero es hablar con el doctor.
Sí, no, perfecto, yo te entiendo. Normalmente es...
De repente empiezan a llamar de diferentes sitios para ofrecerme cosas.
No, muy bien. Todo lo que mandas a través de nuestro website es solamente para nosotros. Nosotros no usamos nuestra información nunca se la damos a nadie. O sea que desde ya cuenta que no vas a recibir cosas de nosotros. Siempre tenemos que poner ciertos disclaimers cuando hacemos transferencias electrónicas por el tema de que pues todos están expuestos a ciberataques y demás. Entonces pues nosotros todos nuestros sistemas son HIPAA compliant, entonces no va a haber ningún problema con eso, pero siempre estos disclaimers tienen que estar mientras tienen que estar. Pero nosotros no compartimos tu información con nadie. Créeme que nosotros nunca te va a empezar a llegar promociones nosotros no compartimos ni tu email, ni tus contactos, ni absolutamente nada. Es todo muy privado.
Ok, perfecto,
Okay.
doctor. Eso era lo que quería preguntar por ahora, porque lo demás es como un poquito más...
Bueno, perfecto. Pues muchas gracias, Oscar. Qué bueno, estás un poquito, como te digo, no estás tan lejos, porque Scotland no está tan lejos.
Ok, bueno, espero que no.
Un placer. Gracias por conectarte.
Bye. Gracias.
Dale, nos vemos. Gracias a ti. Nos vemos.
Chao.
So she was, let me translate a bit. She was asking about patients that live out of the country, how they can finance their procedures. And they usually, when we had patients that had financed their procedures from out of the country, is they had done the financing in their home country. So that's one thing, because you can't really finance with here. And then, she lives in Scotland, so she was asking, how far is that? And I think I always tell them, if you go to Europe, it's almost as far as Canada or Washington or California. Really, it's about the same. It's just the other way around. So we get patients here from all over the country and all over the world. We have done patients from even Japan here. So it's quite impressive, what you can do today. Okay, let's see who else is here. Jahaira, Annelise. See. Very good. So let's see. Let's answer some more questions. Can I have a chemical peel with microabrasion before having fat transfer under the eye? Okay. So let me tell you something. This is another. Yes, you can do the peel, but remember, depends on how soon before the procedure. So I will say I will probably wait for that to have it done after the procedure, because I think when you do fat transfer, it really improves a lot the quality of your skin. And remember, one more thing, we can be providing services like microneedling and PRP injections and all that when you're doing your surgery. So if you're interested on this type of facial rejuvenation treatments, especially if you're doing also fat grafting to your face, don't forget to ask about microneedling and PRP injections, because those are two things that are kind of uncomfortable to have it done without anesthesia, but since you're gonna be under anesthesia, then you can have it, at the same time that you're having the surgery. So those are great additions. Fat transfer to your face is great for facial rejuvenation, and then for your skin to glow, ask for the microneedling and the PRP. Those things can be easily added to your procedures, and your sleep. The recovery is only like a few days. So while you're here, you recover completely from that, and then your skin will be beautiful and glowing, so that is a great way to take advantage of your anesthesia. One anesthesia, multiple procedures, and facial rejuvenation. What else can you ask for? That's great. So don't forget about microneedling, PRP treatments. Those are amazing add-ons that you can add to your procedure while you're having general anesthesia. Let's see. When is it okay to start creams on incision sites? Scar treatments usually is about a month after the procedure when all your incisions are healed. Then you can start applying the scar treatment creams. They're usually silicone-based creams. Anierisca está preguntando si tenemos casa de recuperación. Nosotros tenemos algo mejor que casas de recuperación. Tenemos un hotel donde te recuperas aquí, bajo nuestra supervisión. Nosotros tenemos una cosa que se llama el paquete premium para recuperación. Aquí estamos trabajando con un Sheraton, aquí un hotel Sheraton, donde te quedas en tu habitación privada, te damos los masajes en tu habitación, tenés un cuidado de un especialista en tu habitación y nosotros también te visitamos a tu habitación. Así que es excelente. Tenemos todo preparado para nuestros pacientes que vienen de afuera y de habla hispana, obviamente, como pueden ver.
Y eso incluye masajes linfáticos. I want to say this in English so everybody understands it.
Yeah.
For the people that are just asking, do you have a recovery house? No, we have
también.
something much better than a recovery house. We have a hotel for you with your private room that you can bring a guest that is included in the package. It's called Premium Stay Package. So we really recommend. Am I getting cut off in Magic Surgery?
No,
I'm
no,
sorry,
you're
guys.
good, you're good. They
I'm
said
good?
that.
Okay, because I'm seeing only like my
I know.
chest. So I strongly recommend that you get the package because it is not a recovery house, thank God. It is actually a hotel where you get your private room with 30 hours of assistance of somebody right next to you if anything happens, if you need help for anything. You add to that 30 lymphatic massages that you will need. Believe me, the body really gets swollen after surgery and you need to take all that inflammation out.
Yeah.
Yes, the massages can be a little bit painful, but then once they do it, you feel like you're touching the sky with your hands. That's how relief you feel. And the transportation is included also. That goes to and from the hotel to the clinic, which you don't have to worry about an Uber, a taxi, and how do you get there. We have the lymphatic massage, 30-hour assistant, a beautiful hotel that has a fountain, it has water. I think that, if I'm not wrong with this, is brunch or breakfast included for one of you guys.
Right.
We don't want to forget about that either. It has a big buffet there. So, this is a really good deal, you guys, because you're not getting a recovery house. You're not going to be thrown in a room with 30 other people snoring. Hello, I'm a light sleeper. It's hell for me when that happens, and you need a really good night's sleep. And the doctor comes and visits you on top of it. It doesn't get any better than this. Well, actually, it does, but that would be a BBL that you would perform on me.
Leonardo debe ser argentino porque pone che. How common, let's see. Here I have a question that says, I have a scar on my arm that looks like Frankenstein. Could I have anything done to it during my tummy tuck? The answer is most likely yes. If you need a scar revision, it's great to do it while you're under anesthesia too. So if you have a scar there that you don't like, just make sure you send us photos and then we'll let you know. Estaba preguntando también cuál es el peso requerido para un tummy tuck. El peso requerido depende mucho de la distribución grasa, así que mándanos fotos, dinos cuánto pesas y te podemos aconsejar. Pero lo mejor es que tengas un índice de masa corporal menor de 30, un BMI menor de 30. Así. What else? Can you pay cash or is best to the cashier's check? Really doesn't matter. I think it's easier and safer to travel with the cashier's check. I think that is the best thing in terms of paying cash. If you bring cashier's check is probably the best because it's less risky for everyone. So it's a good question. If you're paying cash, consider that.
As well.
Yeah, you can pay with Bitcoin. We got a few surgeries already booked with Bitcoins. So if you guys have Bitcoins and you're doing good, then we're happy to accept your payment using Bitcoin. Or any cryptocurrency, actually. Yeah, you're right. Any crypto. Ethereum, BSV, anything.
Oh, wait.
That'd be good.
So can I recommend something I forgot?
You can.
Yes. Guys, for a lot of you guys that have been watching us for a while, we used to have something called Cell Saver. But right now we have transferred that to something called Pro Care Coverage, which it has a lot of items. He can go over this right now in a minute because he's the doctor. I'm just like the communicator here. that it has a lot of items to qualify, like if you need protection. It's like an insurance for plastic surgery
Well,
inside of our clinic.
It's more than that because we actually do things. The insurance is just things just in case. We actually do things when you pay for the Pro Care coverage. One of the things that is amazing that we do is we monitor your hemoglobin 24/7. Well, we monitor during the surgery, and then we can monitor while you are in the hotel, which is really good. So we can actually tell how much your blood levels have dropped, and if you need like a blood transfusion or something in a non-invasive way, so without sticking you. So those things are included in the Pro Care coverage. And
The brain
if you
scan.
yeah, we also do that. We also
amazing.
monitor while you're asleep, how to see how deep asleep you are, because you don't want to be too deeply asleep or too shallowly asleep.
For the ones that
So-
are really worried, I have a lot of patients in the morning that I interview. They're really worried about the situation when they go under. Well, we monitor that too. Now, mind you, because they were asking how much is the Pro Care coverage.
$500. It's the same thing that we used to charge for Cell Saver. But
So
now
instead of
includes
Cell
the
Saver,
Cell Saver.
right, include Cell Saver plus all these items. They're like 7. There's a video of the Pro Care coverage. We insist, and I always post in social media, to watch it in our YouTube channel, Top Aesthetics Official. We have a Pro Care coverage video. I think it's called Pro Care package. I encourage you to watch it because it says all the things that it includes, and it's only $500, and you can rest and be peaceful that nothing is going to happen because that includes everything.
That's exactly right. So yeah, the Pro Care coverage, and also it's very important when you are combining procedures, when you're doing a combination of procedures. If you are over 50, definitely it's important for us to keep a closer eye on these things. So I think it's important that you consider this if your BMI is over 30. If you are doing lipo, and you have a higher BMI, because there's more chances that you might have because we remove more fat and more blood, so it's important to be on top of that. So
Do I need to get Pro Care package if I don't want it?
yes, depending, and there are some cases that it's mandatory to do the Pro Care package. If your hemoglobin is low, if your BMI is over 30, if you're doing a combination of procedures, of your age is over 50. So in those cases, you have to do the Pro Care package. If you're 32, healthy, having a BBL with a BMI of 28, it's recommended, but not necessarily. But if you're not in that category, if you're over 50 years old, if you're anemic with a hemoglobin between 11 and 12, if you are over a BMI of 30 and having liposuction, or if you're doing a combination of procedures, then you have to have it. All right. Is there protocols for cancer patients who recently had it? Well, we need to. That's a very broad question. We need to see what kind of cancer do you have. Ana Calix, sí hablamos español. Si quieres preguntarnos algo en español, nos puedes preguntar en español.
Okay, one thing that I want to...
Yeah, so it's, for cancer patients, we have done surgery. In fact, the surgery, I don't know if you saw the patient, interacted with us. Patients we have done surgeries in patients that had cancer and are cured from that or have been treated. So, but we need to see exactly, we need to send us your consultation and we'll let you know.
Now, guys, 2 things. The consultation is free, which is really amazing because you sent everything. You put your doubts, your pictures. Please make sure you take the pictures correctly. And when I say this, I mean like that he can evaluate it better. If you're in a bikini or naked, that's even better. But make sure in the background there's not a mess, dogs and things that are smashed like college students, because otherwise it's really hard to see clearly. With a clear background is better. 2 more things that I want to say, because we did have these problems and we want to warn you. We cannot have your companion inside here for the surgery. Many husbands, which I think they're adorable, I love you all, they want to be here waiting until the surgery is over, which is 3 or 4 hours. We can't have anybody waiting here. First of all, because of COVID, and then because people are in and out all the time, and it gets really congested. So we don't want a person waiting 3 hours there, which when you wake up from surgery, you're very asleep anyways and drowsy. There's nothing that he can do. The nurses bring you out. They put you inside of the van that we have. They carry you to the hotel, and he can wait for you there when you arrive.
Yeah, exactly.
That's the first thing.
Watch Netflix.
Yeah.
Watch Netflix in the hotel.
And then the other thing is that, please, no pets allowed. I know you have a lot of service dogs. I love animals myself, but it's really, really hard. We cannot allow any type of pets here, nor in the hotel. Mind yourself, the animals always, come and go, and they have bacteria and little things that you never know. You don't want that to get into your recently operated body. This is a risk for an infection. So it's for your own good that we say this.
And if you bring your family, they can stay in a room next to you. So that's great. Stay in a room next to you and it should be no problems. No problems. But you got to get 2 rooms. So, a ver, what else? What else? I have, so you know what? Let me show you again one thing that you can see in our website. This is topaesthetics.com. You can come here and you can go to home. And if you want to send us a free consultation, just go to the free consultation link right in the center of the page. And you just have to fill out that form. It's like a pretty simple form. You can see it, everyone. And then if you are interested in, let's say, financing, so you go to resources in this menu right here, go to the bottom where it says finance, and then you can go straight here, Care Credit and Alpheon. If you click, for example, in Care Credit here, and you go to the corner where it says calculate, it will tell you exactly how much your payments have to be, depending on how much you financing. So that's also a really good way to do that. And then there's a lot of more cool stuff, so check, there's a lot of information. We have an amazing YouTube channel that we answer all these questions for you all the time. So I think that's important, okay? So
that he has all the videos about recovery, about sleeping, how do you sleep when you get more than 2 procedures. We have the ProCare coverage explanatory there that everything that we're getting done. We talk about anesthesia, about clearance, about labs, about every doubt that you have is there. Also, you guys, we have other outlets that you can follow us, which is TikTok, Snapchat, for the people like me that have no fear to watch live surgeries. It is so fascinating when he cuts the patient and you see every little thing he does. It's interesting because you want to know how is a tummy tuck.
Everyone.
It's not for everyone. Yeah, it's not. So for the people that just don't have any fear about seeing the surgery, you can see what is a mini tummy tuck like, a regular tummy tuck like, what is a fleur de lis like. You could see it live. All the videos are there. If you don't catch it live, you can always, we don't do live Snapchat. We actually record it and we load it. So we have Snapchat, TikTok, if you want to have a little bit of fun, like procedures, how to sleep with a BBL, and have a little bit of fun while you watch it. Personally, I learn with humor. For me, it's the easiest way. So TikTok has that. Then we have Facebook that we post a lot of information. We have Twitter for the fans of Twitter. What else? We got so many social media that I can't remember. The Instagram, Magic Surgeon, and Top Aesthetics. You guys were asking why 2 accounts. Actually, we're going live in 4 accounts. You have the YouTube channel right now, Facebook, Magic Surgeon, and Top Aesthetics.
Yeah.
We go as live as much as we can. We use all our social media. And pretty soon LinkedIn will be there too. I think there's like a button that we can do lives in LinkedIn, I think. So we're exploring that outlet as well. Any questions that you have, you guys, that are unanswered, you're nervous, you're anxious, it's 10 o'clock, tomorrow's your surgery, you can't take it, you're nervous, send us a DM. Sometimes we respond even 11 o'clock at night. So send it. If you have any doubts, you're not being responded, your coordinator didn't get back, it went to spam, send us a DM. We will locate your coordinator, your post-op team. We have a pre-op team, a post-op team. We're highly organized. He has created a wonderful system where there's no doubt that nothing can go wrong because we tackle every single angle. So if you have any doubts, you're nervous, you're curious, you have a question, send us a DM. If we don't know how to respond it, we'll ask the right person and then they'll tell us and we'll tell you.
That's right. ¿Hablas español?
Sí, hablo español.
Qué bueno.
Sí, hablo español. Y bueno, nada, el doctor también me va a hacer un descuento para la nariz y el BBL creo que me lo va a dar gratis, así que bueno.
Vamos a ver. A ver, here it says, how many hours do you stay under anesthesia? We don't do any procedures that take really over 4 hours. So super safe with us. Even the big combinations, usually we do it sooner than that.
Hey,
Hola!
¿cómo están?
Muy bien. Look, we have Dr. Morales here. If you guys want to interact with Dr.
really?
Morales, we are here in the Top Aesthetics Official. You just tune
Say
in.
it. You missed us, Dr. Morales, huh? You missed us?
Well, I was listening to all the important things you said, and I think it's great. I mean, I just wanted to say hi to everyone, and I agree with have a great system, patient financing, the YouTube channel, and everything. I think it's unparalleled. And I've worked in multiple practices, so I can say that this is by far the best system.
That's
And you
awesome.
never found a social media team so good like this one, huh? Say it.
Yes.
Best social media.
Well, thank you. Well, this is Dr. Morales. You guys, let me share. This is Dr. Morales. Many of you guys know him. Many of you guys have gotten surgery with him. He is amazing. He's very patient, very calm, almost the opposite as me. And he is outstanding with his procedures. Many testimonials that we post in our feed are his patients talking about, the stories that they went through. Actually, what is the name of that? Kelly, what's the Kelly?
Yeah, Kelly Jo Smith.
Kelly Jo Smith. You can search for her testimonial in our feed in Top Aesthetics. He operated her, and she gave a blasting testimonial because she was a massive weight loss patient. That's how you say it.
Yes, right.
Mass weight loss patient, something like that.
Massive weight loss patient.
Yeah, and she had the work done by Dr. Morales, and until today, she keeps posting the videos of how good her body looks.
No,
So
yeah.
this is the other doctor.
She's been documented. Her recovery is very good about that, and is always willing also to answer questions from other patients and interactions. She's an excellent patient.
Yeah.
Wow.
Kelly Smith Joe. You can look in our feed. She's there. It's the testimonial that she got operated with Dr. Morales.
All right, guys.
That's
well,
awesome.
Thanks for having me for a little bit. I just wanted to say hi and congrats on everything you're doing.
And we will see you soon next week, probably, right?
Yes,
Also,
of course.
they told me you're bringing an enchilada the next time you're coming, so we're waiting for that food from Mexico.
All right. You guys have a good day.
Thank
Nos
you.
vemos.
Thank you, Doc.
Adios.
Adios.
That's awesome. So if you guys have questions for us, very frequently we are here with Dr. Morales as well. So feel free to join us when we are together. We do it, almost every other week we are together here. What if your BBL didn't show the results at all? Well, maybe there are a lot of factors that are patient dependent, in terms of that, including the recovery. So a lot of times patients forget about how they looked before. So we have a system where we can actually do the follow-up and show you the before and afters. So a lot of times the patients think that, they look the same as before. And then when we show them, they realize that, oh, no, actually, there's quite a bit of a difference. So that's one thing. Second is, the fat retention is very patient specific. It depends on a lot of factors. So some patients need a little bit more than that. Para todos los que hablan español, si tienen preguntas en español, nos pueden hacer preguntas en español y con mucho gusto les responderemos, porque también hablamos español. A ver, so we're gonna be, it's already 6 o'clock now. We've been here for a little bit over an hour, so we're gonna be closing today's live. Let me answer just one more question here. Some people ask about how to treat gynecomastia in men. Can it be treated without surgery? Gynecomastia cannot be treated without surgery. We usually require to do like a breast reduction or the excision of the gland. A lot of times combined with liposuction in order to do that. And also we combine fat transfer to the pectoral area for males to further enhance and improve the overall contour of the chest. We have been doing more and more males in this procedure, and it actually looks amazing, looks really good when you do this combination. But no, depending on the degree of gynecomastia, I'm not aware of any non-surgical treatment for gynecomastia at the moment, so I think the best way to treat that condition is doing either breast reductions, gland excisions, plus minus the fat transfer to the pectoral area. Okay, so let's call it a day. We are going to be doing this again next week, and then we'll get answering more questions and giving you more news next week. Remember to check, things about financing in our website. You can always jump into the website to send us your free consultations. Remember to ask for the microneedling and PRP treatments while you're under anesthesia if you want your face to rejuvenate and glow. Since you're here under anesthesia for a week, usually, then take advantage of that, and we can do some facial treatments for you during your surgical procedure. So make sure you remember all this and have a great night. We will be back with you soon. Adios. One. Finish.